I'm Junidad Zamoras, a student from Zamboanga State College of Marine Sciences and Technology, taking up a Bachelor of Science in Fisheries. In this video presentation, I will present to you a discussion regarding the antimicrobial agents. So, throughout the whole discussion, we will be able to elaborate what is antimicrobial agents, to understand the different types, to determine the side effects, and to discuss the defenses guide. We included a defenses guide because we know that we can't avoid the microbes as they are everywhere. However, we can prevent the infections and diseases caused by these pathogens through this defenses guide. So now, let's begin. First, what is antimicrobial agents? Antimicrobial agents is a drug used to prevent the pathogenicity of microorganisms. From the word drug, it means the substances that can kill or stop the growth of microorganisms and its infections. Some of you might be wondering or asking what is the difference of antimicrobial agents and antimicrobial drugs? Antimicrobial drugs is to treat infections caused by these microbes, while the antimicrobial agents is the fight against microbes. So the difference is the antimicrobial agents is the fight directly to the microbes, while yung drugs is they treat only the infections caused by the microbes. So all antimicrobial drugs are antimicrobial agents, but not all antimicrobial agents are drugs. Now let's move on to the types of antimicrobial agents. We have the antibiotic, used to inhibit the pathogenic activity of the bacteria. Antibiotic, it works by targeting specific part of the bacteria, which can help to cure the infections and prevent from spreading. Next is the antivirals. Antivirals, they can't get rid the virus that stays in the body, but they can ease the symptoms and shorten how long you are sick. So antivirals, it is treatable, however, it is not curable. Next is the antiparasitic. Antiparasitic, it is to treat parasitic infections in people, not just people, but also the animals. For example, yung mga protozoa, helminths, and ectoparasites. Next is antifungals. It is used to prevent fungal activity in the host. Host is an organism that provides home for another microorganisms. Antifungals is used to cure athlete foots, ringworm, meningitis, and etc. We also included the antiseptic as it is used in healthcare to kill or stop the growth of microbes on the skin and mucous membrane. It is used to clean and disinfect wounds, skin, and surfaces to help prevent infections. So, antiseptic is also part of the antimicrobial agents. In terms of antibiotics, we have 5 types of antibiotics. In common, we have the bactericidal antibiotic. It is referring to the directly kill the bacteria rather than inhibiting the growth of the bacteria. While the bacteriostatic antibiotics, it refers to the inhibiting the growth and reproduction of the bacteria rather than killing them directly. Next type of antibiotics is depending on the spectrum of action. Spectrum is referring to a wide range of bacteria that an antibiotic can kill or inhibit. The first one is broad. It is widely used to kill or inhibit the wide range gram-positive and gram-negative bacteria. The other one is narrow. Narrow is widely effective against a specific group of bacteria. So it is from the word specific, it has a limited range of bacteria. The last one is limited. It is effective against single organisms. Now let's move on to the antivirals. We have 7 types of antivirals. The first 5 is more focusing on stopping, preventing, and blocking the viruses. So we have nucleoside, protease inhibitors, N3 or fusion inhibitors, polymerase inhibitors, and neuraminidase inhibitors. Last 2 is focusing on immunity. Interferons, they boost the immune system to fight off viruses. Immune modulators is to help immune system recognize the fight viruses. But all of them, their goal is to fight the virus. In terms of antiparasitic, we have three types: the anthelmintic, antiprotozoal, and ectoparasiticides. Anthelmintic, it is used to treat infections with parasitic worm. Worms can infect various parts of the body, such as intestine, liver, and lungs. So it could cause range of symptoms such as abdominal pain, diarrhea, and weight loss. Next is antiprotozoal. It is used to treat infections caused by protozoa. Infections can be transmitted through contaminated food or water, and insect bites, and even sexual contact. The most common infections is like malaria. Next is the ectoparasiticides, parasites that live on the outside of their host body, such as skin or hair. Insects like ticks, fleas, lice, as well as mites and some types of worm. It could cause skin irritation, itching, and allergic reactions. So that's all for my part. I hope you learned something new and enjoyed my presentation, and this will be continued with my co-presenter.
So, hi everyone, I am Jolimi Galiocanta coming from the Bsfi 2A, and I am the next reporter who are going to tackle about the antimicrobial agents of what are those different symptoms, risks, and any diseases that we can get from the certain microbes. So, let's watch. These microbial agents are substances that exhibit antifungal activities and are used to prevent or treat fungal infections. It is also a pharmaceutical fungicide that used to treat fungal infections such as athlete foot, ringworm, candidiasis, and any serious systemic infections like cryptococcal meningitis. These medications work by either killing or inhibiting the growth of fungi. Patients must be very careful in choosing drugs. Distinct classes of antifungal agents target specific sites within fungi to exert their effects, which means the accuracy of drugs to be used. It's not all about using antifungal drugs without examining what type of fungal disease to be used. That's why it is very important to have check-up for proper medications and to avoid much greater risks. Azoles drugs is an antifungal agent that is crucial in treating and managing fungal infections due to their ability to specifically target fungal cells while minimizing harm to host cells. Their mode of actions involve ergosterol, or it is essential for maintaining the proper functioning of fungal cell membranes. Another drug is the polyenes. It is known as a critical tool in combating fungal infections that offers a of actions in a broad spectrum of activity, yet facing challenges related to host toxicity and limitility via oral routes. Another one is the allylamine thiocarbamates drugs. It is essential antifungal agents with a specific mechanism of actions that targets fungal cell membranes, making them effective treatment for a wide range of fungal infections in humans. Understanding this mechanism is essential for combating antifungal resistance and also develop effective treatment strategies. Antiseptics is commonly used in healthcare settings before medical procedures and are available over the counter for minor cuts. Moreover, it is used also for cleaning the skin, wounds, and microbes membranes to kill or prevent the growth of microorganisms like bacteria, fungi, and viruses. In healthcare antiseptics, it plays a crucial role in healthcare settings by preventing infections and reducing the growth of microorganisms on external surface of the body. It is also primarily used in healthcare professionals, in hospitals, clinics, doctors, offices, outpatient sections, and homes to protect both the user or the patients from the infections. Consumer antiseptic is vital in maintaining hygiene in various settings, such as homes, schools, and public places like daycares, Antiseptic wash products like antibacterial soap and any liquid products that can be identified as antiseptics. Disadvantages of antiseptics is skin irritations and burns, allergic reactions, regulatory concerns, and product contaminations. These disadvantages shows the importance of using antiseptics cautiously and being aware of potential risks associated with their use. There are some problems associated with the use of antimicrobial agents. We have direct effects, hypersensitivity, changes in microbial flora, drug interactions, and microbial Indirect effects, the tissues or organ system resulting in toxicity, such as the use of chloramphenicol and anemia. Hypersensitivity problems, type I hypersensitivity reaction, which can proceed to anaphylaxis and are thought to be mediated by hypersensitivity mechanisms such as serum sickness. In changes in microbial flora, it's particularly of broad spectrum agents may diminish most of host flora and render subject at risk of colonizations. However, in drug interactions, the ingestions of two or more drugs may result in unforeseen or unexpected adverse reactions. However, also in microbial the use of antimicrobial can interfere the natural ecosystem of the host microbiota, leading to the overgrowth of pathogenic species and causing infections and other adverse drug reactions. Antimicrobial agents plays a vital role in treating infections in the elderly populations, but their use can present unique challenges and risks due to age-related changes. So here are some effects of using antimicrobial agents in the elderly people. Older adults are at higher risk of infections, which can lead to significant morbidity and mortality. Absorption of antimicrobials may be affected by age-related gastrointestinal changes, potentially impacting drug efficiency. Usually, the adverse reactions in older adults using antimicrobial agents include nephrotoxicity, myopathy from statin and cognitive changes from sedative medications. On the other hand, antimicrobial stewardship interventions are crucial for optimizing antimicrobial use in older patients, focusing on adherence to guidelines, dosage adjustment, and monitoring for therapeutic effectiveness and safety. For healthcare professionals, to guarantee safe and effective treatment while minimizing risks related to age-related changes, it's beneficial to fully understand the intricate details of using antimicrobial agents in the elderly. For older patients, antimicrobial therapy optimization requires customized interventions and antimicrobial stewardship programs. Preventing the spread of diseases and microorganisms requires maintaining a clean environment. Microbes that pose a serious risk to human health include bacteria, viruses, and fungi, which can live on surfaces for weeks or months. Health-associated infection can result in life-threatening illness, or even worse is death. Can spread through contaminated surfaces in healthcare settings. To lower the risk, surfaces must be cleaned and disinfected properly. Further important in halting the spread of illnesses and germs are personal hygiene habits like washing your hands and many more doings.